You know, there's a reason why doctors often say, age is just a number, until it comes to certain health issues. And for many men, one of those issues is erectile dysfunction. But here's the surprising truth. It's not just about getting older, it's about what aging does to the rest of your body. Chapter 1. The Myth versus Reality. Many men believe ED is an inevitable part of aging, something that just happens as you get older. The truth? Age itself isn't the direct cause, but the health changes that often come with it are. Think of it like a car. The older it gets, the more wear and tear on the engine, the tires, and the fuel system. Your body works in a similar way. Chapter 2. Blood flow and aging. One of the biggest changes with age is reduced blood vessel elasticity. Over time, arteries can become narrower or stiffer, often due to conditions like high blood pressure or cholesterol. Since a strong erection depends on good blood flow, even small changes in circulation can make a big difference. Chapter 3. Hormonal shifts. Testosterone naturally declines with age, sometimes slowly, sometimes faster. Lower testosterone can affect sex drive, mood, and the ability to achieve or maintain an erection. It's not about losing masculinity. It's about a chemical shift in your body's balance. Chapter 4. Nerve health and medical conditions. Diabetes, nerve damage, or even long-term injuries become more common with age, and all of these can impact the signals between the brain and the penis. If those nerve signals weaken or slow, erections can be harder to achieve. Chapter 5. Lifestyle and mental health factors. As we age, lifestyle patterns catch up with us. Years of smoking, poor diet, lack of exercise, or stress can all play a role. And mental health, anxiety about performance, relationship worries, or depression can amplify the problem. Chapter 6. The good news. Getting older doesn't mean giving up on your sex life. With the right medical advice, lifestyle adjustments, and sometimes simple treatments, many men regain healthy sexual function, even well into their 70s and beyond. So remember, aging changes the body, but it doesn't have to end intimacy. The key is understanding the changes, addressing the underlying causes, and seeking help when needed. Because a fulfilling sex life doesn't have an age limit, only a health limit.